Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed Al-Sheef, your host for Elixir of Life, live from Saudi TV, Channel 2, kicking off another inspiring and informative episode with our distinguished guest, aiming to explore new frontiers and bring you the most up-to-date and latest information related to health. Our program is filled with many inventive segments. Most importantly is the topic of the week, common problems of the Jew. With our distinguished guest, Dr. Fatimah, NasserAllah, she is maxillofacial surgeon. Without further ado, we'll go for a break. Stay with us. Don't go away. Now we'll start with the first segment. We'll go for the quote of the week. Please see more details in this report. Now we'll go for the next segment. It will be medical news. We'll talk about a medical news, 28th Saudi Dental Society International Dental Conference. To see more details in this report, please stay with us.
Assalamu alaikum wa rahmatullah. I would like to thank you for attending this ceremony. I am Dr. Ali Al-Rumay Khan from Ministry of Health and Dental Administration. I attend this event. It is well equipped, and I saw many people visiting this show and high-level education. And I advise all the dental student and resident to attend these events. They get a lot of benefit from high level of education, high speaker. Also, I appreciate all the efforts that did by the Dental Society. And I would like to thank the TV to come and show all people what's going on.
Dr. Sarah Al-Abdallah from Security Forces Hospital. Inshallah, prosthodontic postgrad في المستقبل. The exhibition, we bought a lot of products. Lectures were high quality. Very interesting topics from all specialties. The audio visual effects were very impressive, mashallah, tabarakallah. It was worth it. Yani.
A message you'd like to send to the viewers and to the students, what's the message will be?
Always attend these conferences, even if you go out with a single information, it's always worth it. It's always good to make social encounters with people in your field, connections and things like that. Poster presentations are very important. It's one of the most important things while applying for postgrad, even if you don't win. Just being accepted to a very important and very big event like this event, it's a true honor for you.
We thank you so much for your time. Wish you all the best.
Thank you.
Hi, my name is Dr. Sarah Mohammed Al-Shamrani. I'm graduated from Al-Farabi University. I'm here for presenting my country and also this conference and my university. I'm very proud and happy. We have a new good news. We have a free clinic for treatment that man who died for Saudi soldering.
Okay, a message you'd like to send to the students, to teachers. What's the message will be?
I want to say thank you for every dentist. Give us the time for good knowledge.
Once again, welcome back to Elixir of Life. Now we'll go for the next segment. Will be about health, myth, and fact. We'll talk about nuts are too fattening, eat them sparingly. To see more details in this report, please stay with us. Don't go away. Welcome back to Elixir of Life. Now we are coming to the most important segment, which is topic of the week. What are the common causes of jaw problems? And my honor and privilege to present Dr. Fatimah Zaki NasserAllah. She is maxillofacial surgery specialist from King Saud Medical City. Welcome, Dr. Fatimah.
Thank you, Dr. Mohammed al-Sheef, and it's my pleasure actually to have here tonight. Thanks to the Saudi channel for hosting me, and thank you for being added for this program, for bringing such distinguished speakers, great topics, and always controversial issues.
It's actually our honor and privilege. You are adding to our program and adding value and raising the bar. Without further delay, we'll go to the questions. Starting because beside you is a skull.
Yeah.
I will ask you what is the structure or the anatomy of the skull, particularly your maxillo, jaw.
Yes.
Okay.
Because our topic today is regarding temporomandibular joints, and for the audience who doesn't know what's temporomandibular joints, actually it's related for mainly it's like two structures in the word, but it's meaning a lot, especially when we're saying disorders.
So
like
complex.
This is the skull, and let's say that this is the glenoid here. Okay, so this is the mandible, this is the lower jaw, this is the joint.
So
here.
you can have close view, okay, to this one.
Yeah. Here, this is the joint, okay, or we call it the condyle. And this is the glenoid fossa, or the fossa itself. And between them, there is the gliding disc. And additionally, so when they say temporomandibular joint, they are relating this temporal bone, which is here, to mandibular, and the joint is between them. And when they say disorders, they mean not the disorders are related to the joint, no. Because there is a lot of muscle attachments, there is a lot of ligamental attachment attached to this joint. And these muscles and these ligaments, if they get affected, and they can affect the joint, they can affect the surrounding structure, and they can cause this disorders or this common terminologies.
Excellent. So just to say that the anatomy, so the teeth is that related to the mandible?
To the mandible, to the lower jaw, yeah.
To the lower jaw.
Yeah.
And you mean the temporal, it's part of the skull, okay? So
yeah,
this
temporal is the temporal bone, and the mandible is this jaw, and this is the joint. So temporomandibular joint.
Excellent. Just because the model beside it. Okay, what about the blood supply for this? Because this is area, maybe we see the other, skull, there is a lot of vessels, okay, coming. How is it complex or just straightforward? Because when you are you know, injecting the...
Actually, you know, regarding like the blood vessels, and it's like an area of concern as us as a surgeon. Generally, yes, the head is very rich supply area, and we are concerning, it's a surgery area if we're going to talk
because
like
in the
about
other
the blood
model you
vessels.
can see, the other model we can
Ah, yes, the blood vessels. Yes, it's a rich blood area. We can talk about the auriculotemporal. We can talk also about the maxillary artery. This is like the most significant structures that we can see beneath and around the TMJ. And it's relevant to us in our surgeries, yes.
Excellent, great. So what are the common causes of jaw problems in your clinical practice?
Okay, let's say that before we start, you have asked me that what's the percentage of TMJ, and what's the percentage of TMJ disorders, and they told you that I don't have like a current specific review regarding the whole disorders that we have it. Why? Because you, Mohammed, you might have TMJ disorder. Here, the photographer, me, I can have TMJ disorders.
So TMJ stand for Temporomandibular Joint
disorders. Okay, so let's talk about disorders. The cause of stress can be psychiatric issue, can be malocclusion, a malalignment of the teeth, improper bite, can be previous trauma, can be high dental filling, okay, or improper prosthesis or restorations done for the teeth. It can be certain types of tumors in the jaw itself. I'm talking to you from the simplest thing to the most complicated thing. Can be like a fracture. Can be, if we go like also for the simple thing like the clenching habit, the people who clench their teeth or bite always on their
stress,
teeth. Yeah, because of the stress, either in the day or in the night. And actually, it's a lot.
But what's the most common in your clinical practice you see in daily practice? Stress,
yeah. Stress. Like if you come to the main cause, it's psychiatric issue. It's a stress. Some of the patients, they can be with internal derangement, which is a specific form of this disorders, and it could be because of the long treatment visit. This patient went to the dentist and he kept his mouth open for a long time, or he kept his mouth for a long time open to do an extraction. So this affects his jaw. Yeah, and so, some of them can be because of bad habits, actually. Bad habits like chewing gum continuously. Yeah.
So chewing gum is bad for
yeah,
the...
it's bad, yes.
It's
because
not exercise.
You are overactivating because you are overactivating your muscles and the joint also.
Because there is misconception, you know, or misperception public that, you know, chewing gum is,
it's good to activate the saliva, but it's bad for the people who have TMJ disorders. That's why people with TMJ disorders, we told them no more chewing gum. Yeah.
Excellent, great. Now we are coming, how the patient, or how do I know I have jaw problems?
Okay.
What are the symptoms? Okay.
Okay, you don't have to be educated. Non-educated patient will come and he will point at his joint and he will say, okay, there is a strange voice. Okay, a strange sound that I can hear it in my voice, in my joint. When I eat, when I open widely, sometimes when I laugh, and sometimes spontaneously with no provoking factor or specific cause. And some will come, will say, not voice only, no. They will report that there is a pain, okay? And this pain, they can prescribe it when they wake up in the morning. They can prescribe it like sometimes during the day, like when they talk for a long time or when they laugh for a long time. Some will prescribe it like spontaneously.
So this is like what we call intermittent jaw claudication. This is
you mean the clicking and the crepitations?
Yeah, I mean
this is like another different terminologies for the sound itself. Yeah, and it's and it's under the category of internal derangement of the TMJ itself. Your question was regarding the symptoms and the signs. Yes. So it can be by the sound, which is like the simplest. And by the way, when we mention sign and symptoms, that not every symptom that the patient will have, this will necessitate for him to come urgently to the doctor and seek for treatment. Okay, and we talk about the pain, we talk about this. Yes, locked jaw. Like the patient is opening his mouth and suddenly it's locked. He cannot close it.
He cannot close it, okay.
Okay. Or the opposite. Like he closes his mouth and then he cannot open it. Okay, and some of the also of the jaw problems that we might saw also in the clinics, like the jaw ankylosis. It's like not like episodic that happen during the day. No, it's happen and the patient is living with it, especially with the children. If the children have like some kind of a trauma when he's young, especially on his chin, and he have like this condylar fracture, and then his parent didn't notice this trauma. What will happen sometimes of ankylosis? So he might develop a chin deviation, he might develop restricted mouth opening, and then his parents, maybe they will seek for a treatment.
So jaw ankylosis as a terminology is a fusion of the joint?
A fusion, it could be fibrous, it could be bony, depending on the degree that the patient will come.
Excellent.
Yes, and when it's come, we're going to develop, according to the situation, we're going to deliver different surgical modalities for the patient.
Very interesting, Dr. Fatimah. Among the symptoms, what are the red flag symptoms that should not be ignored by the patient and should seek medical attention, you know, for our viewers?
You know, like most of the patients, which I consider it like risky and red flag, is swelling at this area.
Swelling, right.
Swelling at this area. It could be tumor. It could be because of hitting by certain object, it could be by assault, it could be by hitting shin at the shin area, and the force will be reflected here. It could indicate like simple fracture at here at this area, at the condylar fracture. I think yes.
That's the red flag, you know.
I would consider it yes.
Serious, okay.
Yeah, I would consider it like a serious, and in addition to the locked jaw, yes. The patient should seek a treatment for it and doesn't ignore it, even if they can unlock their jaws by themselves.
Yeah, I mean, along the same, you know, theme, because you mentioned that children are more, you know, susceptible to jaw fusion or ankylosis. How we, I mean, like for our viewers.
Okay, let me correct it. Usually the children, when they get the trauma on their shin or on their face, and they develop like a crack, like a fracture on their joint, okay, or in their subcondylar area, and like the parents ignore it, or the doctor didn't notice it.
Yes.
And with the growing, he just developed a fusion of this area. So it's not like common with children, but usually when the patients come, when they are growing up, and they came with a like, we see one side of the jaw is growing other than the other side.
It's developmental, okay, so...
yeah, why? Because this normal side is continuing in growing. The other side is static, it's stopping growing because of the ankylosis which happened. This is the area. And the patient, when he will come, he will have deviated chin also. And then he will come, he will ask for, he said, I'm having deviated chin, I'm having one side of my face elongated than the other, and I'm seeking for treatment. And then we're reminding him, we're asking him, did you have any trauma when you are a child?
Okay, yeah. So the message for the parents, if the child have a trauma in this area...
Yes, it's better to investigate about it. If the child fell on his face, it's better to investigate about it and doesn't ignore it. Yeah.
Not by general physician, it should be by...
Yeah, it's better to be by the dentist.
By dentist.
It's better by the office even, because even the dentist, he might ignore this sign, and the child may develop like at the beginning small swelling here at this area or pain at this area.
Because just to make it clear for dear viewers, because your specialty is maxillofacial surgeon specialist, and there is dentist. Is there any difference between dentist?
Yeah, there is a big difference.
Okay, can you just enlighten us?
There is a big difference.
Yeah.
Okay, so dentistry is the broad spectrum, like the medicine is broad spectrum, and I can say that the maxillofacial surgery is maybe the only specialty that combine the both, combine this dentistry and combine the medicine. So when we come to the dentistry, yes, dentistry is our roots and is our basic, because finally most of our practice, like the trauma and orthognathic and maybe even the jaw disorders, TMJ, if we are not familiar with the occlusion or how we return the teeth back and we align it good, we will fail to manage the TMJ probably, or even correct the face. Even if you correct it outside here, the dentition will be disturbed, and if it's disturbed, you will have headache, you will have pain in your musculature, you will have myofascial pain. You just reminded me by the myofascial pain, because myofascial pain Yes, I can classify it as the most common category of the temporomandibular joint disorders. And it's related to the muscles of mastication, like the temporalis, the masseter, lateral pterygoid. Yes, when you develop pain at these muscles, not at the joint itself. Yes, and you might develop also migraine because of it, and headache. Yeah.
Yeah, intriguing. This is leading us to the what causes temporomandibular joint dysfunction. So,
okay. So maybe the chronic use of these wrong habits, because as I mentioned, that the causes, which is like the stress, the clenching habit, all of this, if we are using it chronically, definitely it would cause dysfunction. Not like exactly dysfunction, because the patient most of the time will be aware regarding it, and before it's developed to the locked jaw or unlocked jaw, because if it's like unlocked jaw, he's going to lock his jaw many times, and then he will come to the physician, because at certain time he will say, I cannot unlock my jaw, and we will have this sort of like, this is the disc, and the condyle is sliding like this, and then we can go to the other to the surgical modalities, but definitely not all TMJ disorders will go immediately to surgical modalities. No, depending on the condition, depending on the diagnosis.
And the is it a disease, temporomandibular joint? I mean, TMD or
TMD is abbreviation.
Is abbreviation, okay. Is it a syndrome or just
no, temporomandibular joint disorders.
Sure,
disorders.
Okay. And now we have spoken about the clinical presentation, the signs and symptoms. Now going to diagnosis. What are the diagnostic modalities used to diagnose temporomandibular joint disorders?
Mainly examination, by manual examination in the clinic. And we're going to take certain kind of x-rays, starting with our OBG or the dental panorama that will show us the jaws, okay, and will show us the teeth alignment, will show us if there is any fracture in the area. If the patient, we are suspecting like kind of ankylosis or kind of a tumor or any lesion and the joint itself, we're going to jump with the CT, CT with contrast, MRI, depending on the condition, because there is a variant conditions. This is like the main modalities we are using.
X-rays,
the main like direct modalities, it doesn't exclude the other modalities that they are used. Yes, some of them they are using ultrasound, okay, to see the fluid content with the disc. But for the practice, for the direct diagnosis, it will be. But mainly it's like a clinical. Like you cannot like give 70% of the diagnosis by clinical. Yeah.
Excellent. So clinical, history and physical examination.
History is the main from the patient.
Essential and supplemented by radiology.
Yeah, there is another thing that sometimes we use the lab investigations can be of help, because some of the TMJ disorders can be related to rheumatoid arthritis. Some of them can be rheumatoid arthritis
or temporal arthritis. Temporal arthritis.
Yes, rheumatoid arthritis. Yes. Especially if it's related to the other joints in the body, and some they have reported vitamin D deficiency also can help. Also, it's not evidence-based, can help in decreasing the signs of pain with the patient with TMD.
Great. So, I mean, there are some systemic diseases that can affect, temporomandibular joint, like you mentioned rheumatoid arthritis.
Osteoarthritis, if it's unilateral, also can be affected.
It can affect this joint?
Yeah, it can affect also this joint, yeah.
How common? Is it commonly or like rarely to affect the joint?
Specifically, a certain percentage.
Not in your mind, but it does affect, okay?
Yeah, it does affect, yeah. And it should be in the mind of the clinician when he examines the patient, that he asks about the systemic health in general, and he put this in his mind.
Very interesting. We talk about diagnosis now.
And there is another thing: you should diagnose and evaluate the patient psychological status.
Okay.
Yeah, this is so significant.
How you do it? You refer the patient to say
when the patient come to you and he report like he has a history of locked jaw, that he opened his jaw and he cannot return it back, or he report a history of internal derangement or the clenching habit. it's better to ask him if he have had any traumatic experience, like he lost one of his close friends or one of his close relatives, and suddenly he maybe developed like a seizure attack or something that caused like a spastic movement in his face. Is so significant. And ask him if he have like stress in his life, because in my practice I found it more with the teachers, maybe because they are talking too much. Okay, they are activating their muscles
or
too
stressed,
much.
not only stressed from the student.
Yeah. And the people, especially the adults who lost their parents early,
post-traumatic syndrome,
and they don't have the way of exploring and talking about their problems transparently, so it's well reflected to their health. And also it's better to examine the teeth dentition if you find like the clenching, or you find like there is a signs that this patient is grinding his teeth. So this will give you a clue that he is stressed, and then we will go for treatment modalities for him. So psychological aspect is so significant, you cannot ignore it, because if you ignore it, you will continue just giving the patient treatment. And
so you are treating the symptom but not treating the cause.
Yeah.
So if you suspect,
TMD is all about the cause. Treat the cause so that you will get rid of the symptoms.
So you suspect and you refer the patient to the psychiatrist for proper psychiatric evaluation.
Yeah, for proper psychiatric
and
evaluation.
treatment.
Yeah.
Very interesting. Thank you, Dr. Fatimah, for enlightening us. Now we'll go for a brief report about common causes of jaw problems. Please, to see more details in this report, stay with us.
TMD, sometimes called TMJ, is a cycle of pain, muscle spasms, and jaw joint problems that results when the teeth, chewing muscles, and jaw joints don't work together harmoniously. The letters TMD stand for temporomandibular dysfunction. This refers to problems with the muscles and joints that join the mandible bone of the jaw to the temporal bone at the base of the skull. Symptoms may include headaches, worn teeth, painful muscles in the face, neck, and shoulders, clicking and popping of the jaw joint, earaches, pain behind the eyes, difficulty opening and closing the mouth, ringing in the ears, tingling hands, and other problems. There are many causes of TMD, such as grinding of teeth, an injury, and emotional stress. But a very common cause is a bad bite. When teeth are missing, out of alignment, or worn away, the teeth can't come together evenly. This forces the jaw to shift position and the muscles to work harder than they ideally should to bring the teeth together. You bring your teeth together to swallow thousands of times a day. If your bite is out of alignment, this often causes constant muscle tension, which leads to muscle fatigue, spasm, and pain. The constant strain on the muscles can also pull the disc that cushions the jaw joint out of position. If this happens, the bones of the jaw joint can rub against each other in the nerves, causing pain and damaging the joint. Fortunately, TMD is treatable. First, we'll analyze your bite using advanced equipment to identify any problems. Then we may have you wear a custom-crafted bite splint called an orthotic for the next several months to relax the muscles, restore balance to the jaw joint, and stabilize the bite. Once we have stabilized your bite, we can permanently correct it.
Once again, welcome back to Elixir of Life, and welcome again Dr. Fatimah NasserAllah, maxillofacial surgery specialist. And we have been talking about temporomandibular joint disorders, and we started by clinical presentation, signs, symptoms, causes, then we moved to diagnosis. Now we are coming to the most important point.
Exactly.
What's the role of dentist, and who treat temporomandibular joint disorder after confirming diagnosis?
Okay, your question is so significant because majority of the audience now, they are a dentist. Okay, and the dentist shouldn't ignore the initial signs of the TMJ problem. Initial things, and I told you from the beginning that the causes can be simply because of high filling, high prosthesis. So the patient will develop the headache and the pain in his joint and the clicking habit because of this high filling. And the solution is with the dentist. He can just examine his occlusion and he can reduce it and he can adjust it. Another thing, if the patient present with a clenching habit. Actually, this depends on the education of the dentist himself, because if he couldn't manage the patient, like by providing him the night guard or the splint, which is like, in a simple words, it's like a piece of silicone, okay? It's a material like a silicone, but not silicone exactly. And we give it to the patient to bite on it, and this will decrease the load over the TMJ area. So the pain and the stress will be decreased over the TMJ area and over the teeth itself. It can be wear by in the day, in the night. It can be hard, it can be soft, it can be combined. It has many modalities, and if some of them can correct even your malocclusion, your malbite. Some of the patients, they have like class 2 malocclusion. Class 2, it's like protruded upper teeth and protruded lower teeth. So we can put a repositioning device for them by this small piece. And it's not necessary that every dentist have the knowledge of providing it. Some of the prosthodontists, they are aware of it, and some of the TMD specialists we having in our specialty, actually, other than maxillofacial, other than the dentist, other than prosthodontist, we have temporomandibular joint specialist. It's like a specialty by itself.
Subspecialty.
No, it can be subspecialty, like under the surgery by me, but it can be a specialty by itself, like dentist graduated and then he joined temporomandibular disorder, temporomandibular joint specialty.
Excellent.
Yeah.
Treatment wise, there are many modalities of treatment. We starting one by one. By what can we treat temporomandibular joint disorder by drugs or medications?
Yes, definitely. Actually, it's first of all breaking the bad habits. Breaking the bad habits, like simply avoid eating like the big bites and moving to the smooth and small bites when you are eating. Avoid this habit of clenching your neck at one side or sleeping at one side. Avoiding chewing gum, and when you are laughing like for a long time, just to be careful yourself so that you will control yourself, or when you speak for a loud voice or for a long time, you just control yourself and hold yourself so that you won't cause any fatigue for your muscle. Breaking the habits is the first line. And then, if you have been, now we will start with non-steroidal anti-inflammatory.
So first behavioral, you mentioned behavioral therapy is the most important. First line therapy, yes.
Yes, decreasing the stress in your life. And then moving to the drugs or the medications. Medications can be as a muscle relaxant, okay, and can be non-steroidal anti-inflammatory medication. Non-steroidal anti-inflammatory medication to decrease the inflammation at the area, which can be because of the muscles, because of the joint, because of the ligaments, which is all the body structures around the joint. And we give it for like 2 weeks or 3 weeks on episodic manner. And the muscle relaxant, simply with Parafon, we can start it.
Parafon, okay.
Yeah, it can be given. And then we monitor the patient after breaking the habits and providing also the night guard. Okay, and providing that all of his dentition has been examined by the dentist, there is no high filling, there is no malocclusion that need ortho treatment. And after being finished from this conservative management, we monitor the patient for like 3 months, and even with the night guard that he doesn't show any improvement. Now we can shift to surgical. And still in the surgical, we have conservative and we have like a true surgical treatment. Conservative can be started with, depending on the condition, like if the patient come with myofascial pain, pain in his musculature itself, we can treat him with Botox injection, but it need to be like episodic every 3 to 6 months. So because the Botox function will finish after 3 to 4 months, so he need to renew it. Okay.
So what's the idea of the Botox? Because usually used for cosmetic purposes, so it can be used for other medical. So
yes.
So they inject the Botox.
We inject it at the muscles itself that has pain,
yes,
so that it will paralyze the end fibers of the nerve itself.
Excellent.
Other than the Botox, we have the practice of the prolotherapy also, and we have the practice of erythrothesis. Erythrothesis is still, we will consider it as mini invasive, okay, because this can be done under local anesthesia, can be done not under sedation, a local, or can be under GA. And the idea behind erythrothesis is doing lavage for the joint. So we will do like 2 incisions, one in front, if this is like the joint, one in front and here in front of the ear. But this is the joint here. We put here incision, and there is another incision. So one incision you will inject. You will inject the saline, okay, or the material you want to do the lavage with, like the saline or hyaluronic acid, and the other incision you will get the debris or the inflammatory materials. You will get it out. And we try to manipulate the jaw inside the operation, and accordingly we assess the patient. Another methodology we are using is arthroscopy, but it's like endoscopic procedure. But the additional what's different than erythrothesis is that we use the fibrotic material or the fibrosis which is around the area. We have also injection of autologous blood.
What's autologous? Can you elaborate more about autologous blood?
Injection of the autologous blood in the superior joint space, like if this is the disc and you have the superior space and you have the inferior, so you inject the blood here. This will cause fibrosis. This is used for the patients with unlocked jaw that you want to cause fibrosis for the area. Yes, so that there will be a fibrosis to stabilize their jaw.
So this is whole blood or just only plasma, or they inject?
It's autologous blood.
Autologous, yeah, they whole blood and they inject. Excellent. So now you exhausted all treatment modalities?
This is still, we are in the mini invasive. If we go for
surgery, okay.
Yeah, if we go for like a truly invasive, let's talk about the cases of ankylosis. Cases of ankylosis, we will do something called, okay, so let's assume that this is like the joint and it's ankylosed here. So there is no movement. So we should create a gap, right? You should cut here and we cut here and we put a barrier. This is what we call gap arthroplasty in a simple term. And after we create this gap, it can be only by doing osteotomy, and we then put a barrier like muscle or fat or fascia, okay, especially from the temporal area we can use. Other things, if the patient have facial deformity also, like he have one side of his face more elongated than the other side, we can use the distraction for this area. And there is a big debate either to do the gap arthroplasty alone or to do the distraction. Another thing that I didn't mention, that also in children, if we have it, yes, we're going to do the same, especially with the distraction. But with the children, you're going to use the rib. You might use the rib, yes.
The rib, okay.
You might use the costochondral graft,
okay.
Or the distraction, and there is a controversy in the literature regarding it. The most important post-op for the patient to continue the physical therapy. Physical therapy, otherwise everything will come back.
What kind of physical therapy?
Physical therapy that keeping mouth exercises. You should keep the mouth opening and jaw movements active.
Like talking?
Muscles active. No, there is a certain device that, because intra-op, when you open the patient mouth, we will reach to the normal mouth opening. Normal mouth opening in female it's 5, and in male it's supposed to be 4 to 5. To 4.5, and female from the same 5 to 4.5. Okay, so during the procedure we have achieved the normal opening, and we should keep this normal opening to continue throughout of your life. But it's not by the surgery itself. Surgery is not enough. The other issue should be by you, either by using this device, which is Therabite, and you use it for like 4 times, 6 times per day, and you keep it for like 15 minutes. For the children, we use it immediately in the same operative day. And for the adults, we use it 1 to 2 days. And some of the authors, they mentioned, no, you can use it in the same day just to activate the muscles. And another maneuvers that can be by tongue depressor itself. Tongue depressor, we just you insert like multiple amounts of tongue depressors, and you just increase it incrementally till you achieve the mouth opening that you wanted. And we can give the patient some type of painkiller just to relax his joint. This is the sort of physical therapy, and it should be continued for like forever of his life. Otherwise, everything will regain. And he will go again for a surgical procedure.
Very stunning. Jaw problems more common in males or females? Female, because they are talking too much?
No, not talking too much.
I'm just kidding, okay.
Yeah.
So because you mentioned that if you are, using like chewing or talking a lot, it might affect the jaw.
Because yes, it will cause resorption for the jaw, because you will, yes, it will cause inflammatory action here in the joint. That's why, yeah, you could be right, yes.
Okay. Now during the on-call time, because like road traffic accident are the #1 killer in Saudi Arabia.
Yes.
So how road traffic or motor vehicle accident affect the jaw? And how common? Is it common? What's the mechanism of trauma, and is it right?
It's common. Yeah, it's common. It can be as a direct trauma, and it can be during to insult or attack at the shin area, and the reflection will be here at the jaw area by fracture. But it's common. It's common in children. It's common in adults. Especially if we're talking about the joint, we will talk about here the condylar area.
The ramus.
This is the ramus, and this is the condylar area here.
Okay.
Yeah, but it's kind of common. Yeah.
So if you have the fracture, what kind of
a treatment we should give it to the patient?
You put because usually for fracture we put the
plates.
Plates, huh?
Yeah, if it's like any fracture.
Any
this
fracture,
is like the general rule. Yeah, but for the joint, no. It's depending on the. It's depending actually on many factors. And many factors like the amount of the joint, how much it's fractured. Is it the joint itself, or it's the head, or it's like the neck? Or are we talking specifically now? It's about the condylar fracture. Yeah.
This is the most common condylar fracture. Okay. I mean, in the setting of motor vehicle accident.
No, it's not the most common. No, the most common we can say it's like the zygomatic fracture.
Zygomatic fracture. Where is the zygomatic fracture? Can you just
Zygomatic fracture is here.
Yeah, this is the more common.
Yeah, zygomatic complex. If we going to say yes.
If you have fracture here,
because it's like a prominent area, and if you're going to say it also, yes, the nasal area, it's also prominent.
Yeah. Is it like call it boxing,
boxing or the fist, yeah.
Boxing disease or something like this. They can have fracture, in the maxillofacial area.
Yeah, and they can have fracture in the dental area, or the. You remember? I remember one of the football player who has like a protruded teeth. Yes, he had like a dental fracture. I don't know his name.
Sure.
But yes, but this is the people who have like protruded teeth. They have this sort of. Anything protruded in your face, includes zygoma, including the nose, and including the dentition. If they are protruded, yes, you are suspecting them for a fracture.
Yeah, the player is Rolandino. We'll focus on the program, the medical, and for the sports. So, because the teeth are closely related to the temporomandibular joint, how the oral hygiene, affect the temporomandibular joint? Are they, related to each other, or it has nothing, to do? If you have taken good care of your teeth, doing frequent, teeth brushing, oral hygiene, etc.
If you are not taking care of your teeth will become caries.
Okay.
And you might have inflammation of the gum. And by the end, you will lose your teeth. If you lose your teeth, so your vertical dimension of your face will decrease.
Okay.
Okay. So this will increase the load here. Okay, or will unload the area. This will, yes, definitely will cause pain here and will decrease your facial dimensions.
So that's why it's important. Okay.
Yeah, significantly. Yeah, by indirect way, yes.
Excellent, because you mentioned that the swelling
some of the times, like if you have also missing teeth and you're going to do like implant or prosthesis, is going to improve the condition.
Yeah. Okay, great. If we have, you mentioned that the most worrisome or troublesome is the swelling in the temporomandibular joint area.
Because it will be obvious for the patient.
Obvious, but how can we, differentiate it from salivary gland? Because salivary gland, it just overlay. So how a common we have.
If you talk about the salivary gland, you will talk about the parotid.
Sure, parotid. Yes.
Yeah. Okay. So the location of the parotid gland here, it's like if we talk about like this is the auricle or this is the ear, it's like the swelling will be here. It's like below.
So below, and
below the ear.
yeah.
Here he doesn't have ear, so I can't.
Yeah. Okay.
Okay, but it's like below the ear, and it will be like well defined. But in the joint, no, it will be in the joint itself, and the patient will feel it. And the patient
will feel it.
By the way, it won't be like a chronic. No, I'm talking about a recent trauma. So the patient will have this swelling. If he have like a tumor, he might also have like this swelling in this area. Yeah.
That's very interesting.
Yeah.
Is there any training programs for such great subspecialty in
For
Saudi
TMJ,
Arabia?
it's only by itself.
for maxillofacial surgery and TMJ? Okay.
There is many.
Yeah, can you just mention for our viewers? Okay, I'm sure many.
I don't want to have like a bias for certain programs.
Just briefly,
yes,
okay.
There is many programs, very good programs in Europe and very good programs in US. But depending on your what you want exactly to go for, you want to go for the TMJ specialty, or you want to go for pain management of TMJ, or you want to go for surgical specialty. Yeah.
Excellent. Thank you, Dr. Fatimah Zaki NasserAllah, maxillofacial surgery specialist, for enlightening us about very common disease. And again, it's been a pleasure and honor for us.
It's my honor, Dr. Mohammed. Thank you again for hosting me again, and wish you all the best in your program.
Thank you very much.
Thank you.
Now we'll go for the last segment of our program will be health benefit. To see more details on this report, please stay with us. Once again, welcome back to Elixir of Life. Now we are coming to the end of our episode. We wish you have enjoyed viewing our episode and found it useful, informative, and enlightening. Knowledge is power, and prevention is and awareness is the best prevention. Before I conclude, I would like to thank our distinguished team prepared by Rehab Khalitit and presented by me, Dr. Mohammed Al-Sheef, lighting Abdullah Al-Shammari, sound Mohammed Al-Jutayli, cameraman Nasser Al-Mutayri, Salim Al-Uraybi, Diko Tamer Al-Tureki, directed by Abdullah Al-Walai'i. Until next episode, we wish you a pleasant week ahead. Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye.